Hi, it's Sarah here from Thriving Solo. And in our last session, we started to take a little look at mindfulness and the science behind it. Today, we're going to look at some of the common myths and misconceptions about it so that we can see whether any of those apply to our thinking on mindfulness. And they will help us as well when we want to discuss mindfulness activities with our clients. So let's have a little look at the sorts of things that might crop up when we're thinking about mindfulness. And the myth number one is that mindfulness means emptying your mind. And people feel that mindfulness equals a blank brain. They think it means that we're having to totally empty our thoughts out. And the reality is that a mind that thinks isn't broken, it's doing its job. The practice is noticing, not deleting. So if you're doing some charting in clinic and you notice that you're rushing it, that moment of noticing is mindfulness. You don't need fewer thoughts, you need to be able to spot them sooner and figure out, is this helping me or not? So if your brain is chattering, then that's normal, that's human. So what we're trying to do isn't, like I say, empty the mind, but just notice what the mind is up to. The next one is mindfulness is just relaxation. And oh, I wish that it were. A lot of people try mindfulness because they want calm, and that's fair enough. And mindfulness can feel a little bit calming, but it's not a spa treatment. It doesn't work in the same sort of way. And often our clients or even ourselves can start to try mindfulness, and because then they start to feel more aware of tension, they quit. And the point of mindfulness isn't just relaxation, it's closer to turning the lights on. You see what's already there, but knowing what's there means that you can then make a choice about it. So if a client's only using mindfulness to calm down, they really are going to ditch it the first chance that they get, or the first chance that it doesn't calm them. And like I say, it won't necessarily calm in the first instance. Calm might happen later, but first you have to notice what the brain is actually focusing on. So myth number three, if I'm mindful, I won't get irritated. Again, yes, that would be lovely, wouldn't it? We expect mindfulness to make us permanently nice. It doesn't remove irritation, but it can shorten the fuse. Sorry, not the fuse, the fuse to action time. So it actually gives us a chance to pause and decide how we want to respond rather than simply react. So you still feel it, but you can catch the moment before you snap or spiral or people please, and you start to notice the gap and you start to be able to take a different action that is something that you want to do. So mindfulness is, like I say, noticing what is occurring, and that's something that can help us make progress. Myth number four is mindfulness takes 20 minutes a day minimum. And for a lot of people, they will think, I've not got 20 minutes to be able to do this, and so they don't even start. And that can apply to us just as much, and probably even more so, as a practitioner running a clinic and running a business. Who's got 20 minutes a day to be able to set aside? But it doesn't have to be 20 minutes to make a start on mindfulness. Some practical options that we can fit between clients include a hand washing breath. While you're doing the hand washing, one slow exhale while you wash. That is a mindfulness practice. The door handle reset. We've talked about this in another video. I'll link to that. Feel your hand on the handle of the door before you open it to admit the next client. It can simply be a pause after charting, a deep breath before you hit save. So that's something that, like I say, we need to make sure that people are aware, and that we're aware, that mindfulness doesn't have to take 20 minutes a day. It's even better when we can make it a regular thing. So it might add up to 5 minutes, 10 minutes throughout the day, and that can help a great deal. So myth number 5, mindfulness is sitting still with a perfect posture. Really need to work on my own posture. And so this myth turns off those of us that find it very difficult to sit still, to sit with that perfect posture. You will find that clients that are in pain will just dismiss the idea of mindfulness if they think that's what they've got to do, because they know they can't sit still for that amount of time. But mindfulness works in motion as well. Whether you're out walking, whether you're stretching, even making a cup of tea, we can build mindfulness in to activities. It's where the attention is. So when we're out walking, maybe a few deep breaths, or observing what it is that's around us. As I say, stretching, actually feeling into that stretch, feeling which part of the body we're using for that stretch, which muscles are engaging. As I said, if even just making a cup of tea, it could be a couple of deep breaths while the kettle's going, and then breathing in, inhaling the scent of the tea once it's made. So mindfulness, it can be any of our senses, and for hands-on practitioners, the mindful touch is an easy entryway. When we're working with our clients in a hands-on way, then that touch should be mindful in any case. Myth number 6, mindfulness is spiritual or woo or not evidence-based. Well, we actually covered some of the evidence base in our first session about mindfulness within healthcare. And to some extent, holistic practice is often seen by others as woo, in any case. But we can always point to evidence that backs up that there is some science behind this. But if you've got a client that hears mindfulness and thinks that they're about to be sort of sold on something that doesn't fit with them, then just remember to teach the elements of mindfulness in a plain language without any sort of spiritual packaging. And the fact that it's about attention, primarily attention training, and a kinder response to ourselves, like I say, not judgmental. So you could perhaps talk about doing an attention exercise, or a breathing exercise, making sure that they understand that perhaps we're training the nervous system, or we're working on our emotional response. Avoid big claims, just keep it practical. And as I say, if need be, you can refer them to studies that show how this works. Myth number 7 is mindfulness means acceptance, so I shouldn't change anything. If they think that acceptance means that they don't need to change, they may sort of mix that up with they can just carry on doing what they've always done. But the whole point is that mindfulness is about your attention and directing it and redirecting it if necessary. So it doesn't mean acceptance, but it does mean avoiding self-criticism. It does mean avoiding judgment. This is not noticing that your mind's wandering and criticizing yourself for it. It's accepting that the mind wanders and bringing it back. So we're not approving, we're not unapproving, we're just naming it and bringing it back. Sometimes people think that mindfulness is only for calm people, and then they might feel, I'm not calm, so it can't be for me. Some people feel that they're just too busy-brained to be able to focus, to be able to actually apply mindfulness. But busy minds aren't a barrier, they are the training ground. That is the same for all of us. Our minds wander. It is a normal function of our brains. You don't start fit to go to the gym. You go to the gym and get fit. And it's the same deal here with mindfulness practice. If you could do it in the first place, there would probably be less need for it. But we practice because our attention wanders, and we don't want to be at the beck and call of our attention wandering. We want to control that. We want to be able to respond rather than react. So, mindfulness is not necessarily for calm people. If you were calm, you'd be there already, maybe. Although, again, there are some differences. As I said, it doesn't necessarily mean that it's going to be calm. Now, this next one is very much more for practitioners than our clients. If I teach mindfulness, I'm doing therapy. This is a common worry in holistic clinics, especially with scope of practice boundaries. But you don't need to be teaching mindfulness as therapy. You can simply give some self-care tips to your clients, or exercises within the clinic while you're working. Perhaps a grounding exercise or a breathing exercise to help somebody to move into a more responsive state to be able to enjoy the treatment that they're going to get. But what you do need to be careful of is to make sure that this is all evidence-based and clinically safe. So it's not a substitute for appropriate mental health treatment. It's not a one-size-fits-all intervention, especially if you're dealing with somebody who's had trauma in their history. It's not a quick fix for burnout. It can start to help and provide a structure for dealing with it, but you need to be very aware that you mustn't oversell the benefits of mindfulness. The ethical sweet spot is really mindfulness as a skill that supports regulation, coping, and behaviour change alongside good clinical care and alongside any other medical care that your client may be following. So, as I said on the last session, one of the ways that we can explain this to our clients is that mindfulness helps your brain and nervous system to recover from stress more efficiently so that thoughts, emotions, and symptoms don't take over as quickly. So we're going to have a little look in future sessions at a few short scripts that you could employ for yourself and for your clients. But for the moment, again, I just want you to have a little think this week about, are there any of these myths or misconceptions that have been holding you back from pursuing mindfulness for yourself? And if not, if you don't have any misconceptions about mindfulness, you're very happy with it, then just think about what are the most common ones, do you think, that come up for you amongst your clients? And are there responses that you can give to those objections, those myths, that can help a client be more receptive to actually using this to be able to help themselves, to provide self-care in between your sessions? Please drop me a comment below if you feel that there's something that crops up more frequently than others, and I can make sure that our scripts address that in a future session. So for now, thank you for stopping by, and I'll see you again soon.